Hello, my name is Nicole Barrientos. I'm going to be presenting my fact sheet on cerebral palsy. Cerebral palsy, known as CP, is caused by damage to the developing brain, usually before, during, or shortly after birth. It is a neurological disorder that affects movement, muscle tone, and posture. The etiology and progression includes that CP is non-progressive. This means that the brain injury does not worsen over time. However, symptoms can change over time as the child grows. CP is a lifelong condition, and resources such as therapy and other interventions can greatly improve function and the quality of life. Signs and symptoms commonly seen include poor coordination, stiff or floppy muscle tone, spasticity, involuntary movements, as well as motor skills commonly affected, such as gross and fine motor skills, along with balance and posture. CP may also involve intellectual disabilities, seizures, and sensory impairments. CP is the most common motor disability in childhood, and it affects about 1 in 345 children in the US. There are several precautions and safety considerations to keep in mind, such as risk of falls and joint dislocations, and the use of assistive devices should be monitored. It's also important to monitor for fatigue and skin breakdown, as well as pain. Additionally, as a common sign or symptom included seizures, it's important to be aware of possible seizure history. In terms of OT assessments, there are three main assessments that can be used, including the Gross Motor Function Classification System. This is a five-level tool that is used to describe gross motor abilities of an individual with CP. It has levels 1 through 5, and this helps understand the client's mobility baseline to choose appropriate mobility aids or supports. The Canadian Occupational Performance Measure is a client centered assessment that is used in OT. This helps identify and prioritize daily activities that a client may want, need, or is expected to do. This assessment helps evaluate a client's performance and satisfaction with those activities over time. The following manual ability classification system follows is for children ages 4 through 18 with CP, and it focuses on typical performance. This describes how independent and efficient the child is with their hand use. It is useful for treatment planning and communication with families over time, allowing to track changes over time with their hand mobility and function. There are three occupational deficits that can commonly be seen include dressing, feeding, and toileting. Dressing can be an occupational barrier due to the difficulty with fine motor skills to perform buttoning and zippers due to the fine motor deficits and spasticity. Feeding can also be a difficulty due to the poor coordination and involuntary movements that may affect the utensil use. Lastly, toileting can be difficult due to balance, transfer, height, and hygiene impacted by mobility and poor postural control. Some extra information I added here are the types of cerebral palsy. There are four common different types. Spastic CP is the most common. These are when the muscles are stiff and tight. This is known as spasticity. Movements can be seen as jerky or awkward, and this is caused by damage to the motor cortex. Spastic CP can affect one side of the body, so spastic hemiplegia, both legs or both legs more than arms, spastic diplegia, or all four limbs, which is spastic quadriplegia. Dyskinetic CP can commonly be seen with involuntary and uncontrolled movements. This can be slow or fast. It may have twisting or repetitive movements. Muscle tone can quickly change from being very tight or very loose. This can be caused by the damage to the basal ganglia. Ataxic CP is the third one, and this affects balance and coordination. Movements are shaky or unsteady, and it may have trouble with precise tasks such as writing or buttoning. This is caused by damage to the cerebellum. There's also mixed CP. This is a combination of two or more types, most commonly spastic with dyskinetic. Symptoms may vary depending on which area of the brain is affected. So, with CP, it's important to note that different parts of the brain that are affected will show different signs and symptoms, and that's how you can identify which type of CP it is. This image I have here below explains the different types and what parts of the brain are affected, as well as the body regions affected by cerebral palsy. And here below, I have my references. Thank you.